Lower blepharoplasty with negative vector orbit. I met with 3 different board-certified plastic surgeons in Canada regarding lower bleph. I received 3 different answers. 1. This surgeon said it would be a big mistake to have surgery because of negative vector. The solution? Fillers. 2. A traditional lower bleph with a bit of skin removal. 3. Lower transconjunctival bleph with facial laser resurfacing. This is also confusing. From my pictures, does it appear I should avoid surgery due to negative vector? Could it cause lid retraction or a sunken eye?
Thank you for your question. Well, you have dealt with one of the realities of getting several opinions when you go for different doctors about eyelid surgery. And that's a very important message, is that eyelid surgery is not generic. And people who shop on price or get convinced by very interesting infomercials very often live to regret their decisions because when they make these decisions thinking that every surgeon does a procedure the same way because it all has the same name. So the question that you're most concerned about is about the relative risk of problems related to your negative vector. So let's just define the word negative vector. Negative vector basically means that the cheekbone relative to the projection of the eyeball, the front of the cornea, is back. Therefore, the cheekbones are back and the eye is forward. And so, being a specialist in cosmetic oculofacial plastic surgery and being someone who has done a lot of revisional work, and a good percentage of my practice is about that, I can tell you that it is a risk, but it's a risk that can be managed. So let me explain. When you have a, quote, negative vector, when you do a procedure where the lower eyelid is being operated on by going from the outside and doing something to reduce the fat pockets, you have to balance everything because the position of the lower eyelids is very dependent on multiple factors. The lateral canthal tendon, the position of the lower lid retractors, the tone of the skin, the orbicularis muscle. So there's a lot of technical issues. So I can tell you that although it's a risk, it should not stop you from pursuing the surgery. It's just that you do have to find a doctor who has a lot of experience with eyelid surgery and has the ability to anticipate the issues that can happen and can deal with them. Sometimes when, like a general plastic surgeon who offers eyelid surgery may be able to deal with some minor complications or just things that happen related to the surgery, but they may not be able to do the things that are at the much higher levels. So someone like yourself, now that you're doing the research, you have an opportunity to find someone who can provide that level of care if you need it. So when I look at a face like yours, I think not only of the eyes, but I think of the face as a whole. I happen to also be board certified in facial cosmetic surgery, and I do a lot of facelifts. I do cheek implants and a lot of things to help with facial aging. So when I look at you, I don't just think of the eyes, I think of the face as a whole. And if you talk about a negative vector, a common strategy that I use would be not only to address the eyes, but to address the mid-face, address the cheek area. Consider adding volume, whether it's with a filler or with something more long-term, such as a cheek implant or a submalar implant. So these are the things that are worth considering. And the most important thing for you is to be confident in whoever you go to be able to help you achieve the look that you desire. The key is very much communication and understanding of your desired goals and being prepared to deal with any of the things that can happen regardless of who does the surgery. So I hope that was helpful. I wish you the best of luck. Thank you for your question.